Hello everyone, welcome back to my channel. This is Dr. Zina speaking. Today I'll be speaking about what is necrotizing fasciitis. But before we continue, make sure to smash the subscribe button down below because it would really help me to grow my channel in order to reach many dentists worldwide. So let's start now. As usual, let's start with the definition. The necrotizing fasciitis is also known as a flesh-eating disease. It is an infection that kills the body's soft tissue. In order to remember, necrotizing means dead tissue, and fasciitis, the last four letters ITIS, refers to inflammation. So it is inflammation of the skin, and this inflammation left untreated resulted in dead tissue. Now, what is the cause behind the necrotizing fasciitis? The number one cause is the group A Streptococcus bacteria. This bacteria, it enters the body through a break in the skin, such as cuts, scrapes, burns, or insect bites, or even puncture wounds. So this simple thing can be disastrous because if left untreated, can result in necrotizing fasciitis. Now you might wonder what are the early symptoms that you might experience. The number one is severe pain. Number two is redness and swelling, which are all signs of inflammation because, as I said, ITIS refers to inflammation. Third is warmth. The area will be felt warm. Number four is flu-like symptoms. And lastly is loss of sensation because the tissue there is dead. Because it's dead, so therefore it is non-vital anymore. Now, in order to remember, I created for you a mnemonic that will help you to remember the early symptoms for necrotizing fasciitis, and that is the Sarah's fish. Sarah's S stands for severe pain, A stands for warmth, R stands for the redness and swelling, F stands for flu-like symptoms, and lastly S stands for loss of sensation. I hope it's easy for you right now. Now, what are the late symptoms? There are only two. Number one is skin discoloration. The skin may turn into red, purple, or bluish gray. Lastly is tissue death. That is the last or the end stage of necrotizing fasciitis, in which the skin and the underlying tissues may start to die, turning black. And I created for you a mnemonic, which is the word student. ST, S stands for skin discoloration, and T stands for tissue death or necrosis. Now you might ask me, what is the treatment for my necrotizing fasciitis? The treatment is as simple as that: surgery to remove all the necrotic or all the dead tissue. Now, how to prevent yourself from getting the necrotizing fasciitis is to keeping the skin intact. Wounds should be cleaned and monitored for signs of infection that are the redness, swelling, drainage, and pain. Keeping the skin intact is an important factor in preventing necrotizing fasciitis. Patients with an infected wound and fever, very important, they need to seek medical care before any problem or complication will happen. Furthermore, now, what is the survival rate for patients with necrotizing fasciitis? Now, people with necrotizing fasciitis have a high mortality rate in the range of 20 to 80%. Why is that? Because I said if you have it, the treatment will be surgery to remove all the necrotic tissue. For example, imagine that you have necrotizing fasciitis on your legs. All the skin in your legs, or in other words, all the dead tissue or the necrotic tissue on the surface of your skin will be removed. And because of that, the mortality rate for patients with the necrotizing fasciitis is very high, with treatment or without treatment, because your whole leg would be amputated, right? And that's it.